A very warm welcome to all of you joining us today on yet another edition of The Spotlight. Now, mental health plays a crucial role in any person's life. Stress, anxiety, all of this and much more comes under the realm of mental health and mental well-being. To talk more about this, we have Dr. Malsha De Silva, consultant and psychiatrist from the National Institute of Mental Health. Thank you, Doctor, for joining us today.
Thank you.
Doctor, my first question for you. In your years of experience and expertise in this field, I'm sure you would have come across many patients. And from where you started and to where we are now, in terms of self-awareness and awareness among the people, general public and in the country, where does Sri Lanka stand?
I've been in this field as a consultant for about 10 years now, but I've been a doctor for close to 20 years. So when I started off, social media wasn't this prevalent. People didn't have this much of access to social media, but nowadays, particularly youth, have access to social media and they spend a lot of time looking at their screens. So it's kind of a double-edged sword where there are certain myths being propagated as well as mental health literacy is also increasing. So I'm happy to say, compared to say 10-15 years back, I would say people reach out to mental health services earlier in their problems rather than waiting till things get really problematic. So literacy and awareness is increasing, which is a good thing, but I'm a bit concerned about the negatives that come along with screens, like screen addiction, proneness to violence, and sometimes even depression.
Yes. Now, Doctor, there are many terms that come along with this whole mental health sector. We talk about stress, anxiety attacks, panic attacks. Can you explain to us the differences between these three?
Yeah. Stress is actually a very broad term. Mm-hmm. So it can be used to describe an event or a situation that causes an uncomfortable situation for a person, especially if it overrides their ability or capacity to face a certain challenge, then they can see it as a stressful situation. Then stress can be also used to describe a person's reaction to such a situation. People say, I'm stressed out.
Yeah.
That is different to saying, my work is stressful. So stress has two meanings in that sense. Anxiety, on the other hand, it has a specific meaning, and it is more like a medical term sometimes, where it describes a person's reaction, usually psychological reaction to a stressful situation. And then you mentioned panic attacks, where it's a kind of anxiety, but a specific kind, where a person experiences an exponential rise of anxiety in a very short period of time, where he will experience physical symptoms like breathlessness, sweating, and feeling as if he's going to lose control, as well as, immense fear and feeling scared. But it subsides soon, whereas anxiety can remain for days on end.
Right.
So it's a bit difference is in the intensity and the time scale as well.
What are the factors that trigger these attacks, Doctor?
Panic is a symptom of a disorder. There is an entity called panic disorder in medical terms. So in professional language, it denotes a illness, a mental illness. But in lay terms, panic can be used to situations where a person feels like they are losing control. If we come back to the medical illness, it doesn't necessarily mean that the person is actually facing a fearful situation. Panic can just happen out of the blue. By definition, in fact, in panic disorder, the anxiety is brought on without nothing external. So they are just, could be just relaxing, and the next moment they can have this surge of anxiety coming. So in that sense, in those cases, we might need to help with medications as well as, talking therapy or psychotherapy.
Doctor, when a person is undergoing an anxiety attack or stress or a panic attack, how, let's say, if I'm undergoing, how will I know which one I'm experiencing?
As I said, if you have been all right in 5 minutes back and the next moment you find yourself really agitated, feeling all these physical sensations in a very short period of time, that might usually mean that you're having a panic attack. But anxiety, as I said, can last for hours and days, or even, if someone's in a bad situation, work-wise or relationship-wise, it can go on for years even. So anxiety and panic has similar physical symptoms. Whereas anxiety also brings on shortness of breath, rapid heart rate, sweating. But anxiety, the intensity is much, much more. So that is the difference between the two. But I think for the general public, my message is, if you are having trouble with any of these symptoms, it's always better to talk to your doctor. It doesn't have to be a mental health professional as such. You can talk to your general practitioner, and sometimes they can help you out without referring to someone. But if it is really bad, then you might be referred to someone in the mental health profession.
Doctor, you were mentioning that this comes as a mental disorder, a mental illness. This term illness, has it been an issue when we talk about anxiety and stress?
Yeah, actually, even when I'm describing it to you, I felt a bit hesitant to use that term, because there is a huge stigma attached. Not just in Sri Lanka, I think it's a worldwide phenomenon, but in Sri Lanka, I think it's a bit more than other places, maybe in Asian countries. But as I said, it's changing for the better now. So, whether it's a mental condition, mental illness, or a disease, the most important thing is that you receive the needed help on the needed time. Because if it delays, if your anxiety persists for a long period, then apart from those symptoms I described, the shortness of breath, the sweating, and feeling unable to concentrate on your work, you will also experience some long-term problems.
Such as?
Complications to your health, like hypertension, diabetes, even heart attacks, and even strokes. So the most important message we need to deliver to the society is, if you are having trouble with these symptoms of anxiety, which I told before, if you feel that it is troubling your day-to-day life, it's interrupting your peace, then rather than waiting and seeing whether it goes off on its own, it's always better to reach out to professional help.
Now, doctor, if someone is undergoing all of these issues and they want to receive help, but somehow or another they feel that it might be an embarrassment. So just walk us through what sort of treatment is available for people undergoing anxiety attacks, panic attacks. What sort of help do you all offer to people who undergo these issues?
Okay, so I think before coming to professional help, shall we talk a bit about what you actually can do yourself about, stress?
Is that safe, doctor?
To a certain extent, yes. We do use these strategies in a day-to-day basis, you and me, we are always, as human beings, we are faced with stressful situations, and we have our own set of coping skills that we use every day. What happens with these disorders is you find it difficult to tackle the stressful situation with the skills that you already have with you. So we'll talk a bit about, improving those skills and how to sort of re-evaluate your situation so that you don't have the same stressful outlook on the problem, right?
Definitely.
So if you take a stressful situation, stresses are mainly two types. The way I look at it, there's one kind which you can actually do something about. Certain situations can be adjusted. Then there are other situations that it's basically out of your control. So for those situations that can be adjusted, you can see whether you can actually avoid it. I mean, there are certain stressors I see, even among patients I see, they face it daily without realizing they have a way out of it. You know, it could be a person that they meet on their road, someone who's stressing them out. When I ask them, yes, doctor, I can potentially choose a different time to walk, so I can miss him. So I ask, why don't you do that? I haven't really thought about it. So, you know, simple things.
Yeah.
And then adjusting the stressor. Like say, if you are really stressed out driving in the traffic, right? Leaving home 10 minutes before might bring down your stress level drastically. But people go on doing the same thing, complaining about the traffic without asking themselves, what can I do about it? So adjusting the situation, right? Then we are coming to the next set of stressors that it's basically out of your control. So how can we tackle that? That is where you need to practice the quality of acceptance. Certain things, especially people who have a bit of a trait called perfectionism, they can't take something substandard, right? They want that level of standard in their work or someone else's work. So they go on fighting for that without realizing that all humans are, you know, they have errors. I have to keep a room for that. So that is a way of tackling stresses that's out of your control. And forgiveness is another thing. I mean, especially not with anxiety, with depression, I find people carrying on grudges for a very long time, and the person who has done harm to them doesn't even know that they are having this grudge. They are happily existing while this person, the other person, is suffering. So it's like, you know, there is a saying called continuing a grudge is like drinking poison and hoping that the other person will die. Yeah. You are the one who's suffering. So those are simple strategies or ways of reviewing your issue and, you know, coming into terms with the problem. But, you know, if that fails, if you find yourself stressed out day in and day out and, you know, your coping skills are not helping out, then look for other simple things in life that you can do. Exercise is quite underrated these days because people sit in front of screens and looking at their phones. They hardly have any time for physical activity. In research, they have shown exercises releases certain chemicals in the brain that induces relaxation, especially opioid hormones. And the other thing is good diet. Again, I think with this fast-paced life, we tend to eat whatever that we can grab on the road, you know, and sometimes we tend to skip meals also. Yeah. Especially with this, you know, fad about having a thin body, people miss out on meals and then they develop dyspepsia, which is commonly known as gastritis. And I forgot to actually mention gastritis also is a physical complication of chronic stress because these steroid hormones can actually harm your internal lining of stomach and make you have very painful abdominal pain and regurgitation. So those things. And the other main important thing I wanted to mention is drugs and alcohol, because I see that a lot among youth. When they try to cope with stresses that they can't change, they turn to alcohol and other drugs. So that is something that you need to keep an eye on yourself, whether I'm resorting to something that will make it worse.
Even sleep plays an important role, isn't it, Doctor?
It's very important that you brought it up. Again, sleep for an adult, what they say is you need at least 7 hours of sleep. But I don't see my patients getting that at all. If at all, they sleep 5 or 6 hours. And the interesting thing about with sleep is, lack of sleep rather, is that it gets accumulated with time. You feel that you get up in the morning and you can forget about the lost couple of hours, but it doesn't work that way. There is a kind of a, account in your brain which accumulates the lost hours of sleep. So finally you end up a bit like a zombie.
Right.
Yeah. So that's very important to remember.
Yeah. Moving on with another question, Doctor. Now, mental health in Sri Lanka for men. How are we doing in that arena? Is it still stigmatized or is there improvement?
It is again stigmatized, I think, all over the world. But in Sri Lanka, I think we are doing a bit worse than the rest of the world.
It's more stronger.
Yes, the stigma is more stronger. I think generally what happens with mental disorders related to men is we have this outlook about a man to be strong and, just push whatever things behind him and keep on going rather than complaining about it because it's seen as a weakness. So, and I think, all parents, including myself, we do something wrong at home when we bring up our male children, where when they cry and, show their distress and come to us with their problems, we sometimes, without thinking a lot, we tell them, don't cry like a girl. You should man up. This is the message we give them as a child. So they get this into their system and they feel that I should not talk about my issues. Right? It will show my weakness or femininity, right? So I think that's something we should start changing at home as well as schools. So teachers can, facilitate expression of negative emotions productively among children, especially male children. And when it comes to adults, one thing is, even at workplaces or at home, when they are depressed, they appear not really sad. Men tend to appear aggressive or angry sometimes because they are externalizing, whereas I'm talking in general terms.
Yeah.
So women tend to internalize more and they will look sad and withdrawn, whereas men might show it in a different manner. So it might not fit your general understanding of depression. So they might be blamed for that rather than being helped. But having said that, as I said, I see a lot of young men now presenting to our clinics, either in the private sector or government sector. In fact, it has really grown in the recent times. And their knowledge about illnesses is also increasing. So that is something I think media has played a good part in that as well. So I think things are getting better than before.
Doctor, in your years of experience, coming to that again, the rates of suicide, sometimes statistics show that the rate is higher among men. Is that correct?
That is correct. Again, suicide, and there is another entity called deliberate self-harm, which is different to each other. Deliberate self-harm is an act that done by someone with or without an intent of killing themselves and ending up with not ending their life, whereas suicide is a completed act of self-harm. Again, the intent might not be killing themselves. It might be, showing their anger, but it ends up ending their life. So men, when they're faced with when they are depressed or when they are faced with a situation where they feel like they can't escape, might resort to things that are more intense than a female. So the attempts, if you take just the attempts, they are more in females, but simply because the method chosen is, very intense and violent, the suicides, the completed suicides are more in men.
Because doctor, now a lot of reports that we see in terms of male suicide rates in Sri Lanka, however, the trend is we see women also now sort of heading into work and becoming independent and alpha females. But we see also that most of the time, majority of the families in Sri Lanka, it's the male figure carrying most of the financial burden, keeping the family together. I think those are also common factors that sort of trigger a male into taking such decisions, isn't it?
Yeah, these are added cumulative factors behind an attempt, and especially in the current context, it's a patriarchal society still. So finally, even if the woman is earning, the final burden might fall on the father. So and they fear if they break down, the whole family will come down with him. So I need to man up and keep going. But depression, anxiety are disorders that have treatment. In lay terms, depression, we call it the common cold in mental illness, because it's so prevalent. It's just that people don't come to us for treatment. So it is something that can be cured. There is a lot of help, but it's a disaster that people end up in a situation that you can't basically reverse, right?
Yeah. Moving on into another age group where you might see a lot of issues is the teenage age group when it comes to stress. And that is also a bit of a tricky age group, because this is where the child is transitioning from a child to a youth to an adult. So what are some of the common patterns that you see in teenagers when they come up to you with an issue?
These days, I see a lot of children with exam issues, exam anxiety. Now I think the ordinary level exam is coming up. So every time exam is coming up, the couple of months before that, my clinic is flooded with teenagers, right? So sometimes I think there are several reasons behind it. School system also sometimes plays a bit of exaggeration on performing in certain exams, even though that level of performance really is not needed for that particular child. I will give you an example. This is a very well-functioning girl. She's she's an overall performer in sports and arts and also academic activities, but the school has placed pressure on her to obtain 9 A's. But with all the other things going on, she has been finding it difficult to go to that target, and she doesn't need to achieve that target to do what she wants to do in A levels. So finally she broke down, she couldn't sleep, she couldn't eat, and she was having thoughts of hurting herself. And luckily the parents had the sort of knowledge to bring her to our services, and we treated her and we re-evaluated her goals. And we were able to find an agreeable goal for her to achieve so that she can continue her other extracurricular activities as well. So yeah, those things I think even the teachers and the parents also need to have a think twice.
Now doctor, these problems of stress with teenagers, it also props up when they're children. And children carry this trauma forward, even into their lives of being an adult. Now, I think parents living around the Colombo suburbs have sort of improved their way of thinking and handling their children. If their child goes through a change in, decisions and all of that, the parent will think, okay, something is not right with my child. Let's get this checked. But what about parents, doctor, living outside Colombo, rural areas? Those parents don't have the ability to understand that something is wrong with their child. The first thing they would think is, my child is going off her head or his head. How can we address that situation, doctor?
So it's like in Colombo and suburbs, you have more like a nuclear family where you have the two parents and the child or couple of children. You don't have the extended family around them, so they are tending to their needs by themselves. Whereas in the rural areas, I'm again being very general about this. So in rural areas, you might have your grandparents around, your neighbors, and people are more in a network than in urban areas. So yeah, as you said, urban population might have a better understanding of mental health issues, and they might be able to detect it earlier than similar parent in a rural society. There is another supportive network there, even though that knowledge may not be as prevalent in rural societies. They have a different support system. So I mean, when it comes to the final outcome, I don't see much of a difference in the mental health of a family who are residing in urban area or rural area, because in rural areas, even if these children can't express their feelings to their own parents, they might have a kind grandmother or a grandfather who's emotionally available, or a aunt or an uncle who might not be as critical towards them. So they have that support system. So it's a kind of a balance, I think.
All right, doctors, we have to head into our first break this evening. Remain with us and we will be back because we have much more to talk about. All right, welcome back to the show this evening. So much to talk about, but I'm trying to pack in many questions for you, doctor, because this is a big spectrum, mental health. My question for you, it's not exactly a question per se, but I would like to invite you to please advise our parents watching us today. How do you deal with your children? If your child comes up to you with an issue, instead of shunning them away, saying, I don't have time for you, or whatever you're feeling is not an issue, there are bigger problems in the world. To parents who have that sort of mentality, or parents in general, why don't you talk to them today?
Okay, so I think the work begins even before your child comes to you with a problem, because it's very important to grow this trusting and reciprocal relationship with your child, even before they start to go out into the world, right? So this work starts from the very beginning, when they start talking and walking. There is a concept called circle of trust. If you look at a young child, a toddler, if you look at them playing, they do go out and play with other children. I mean, they parallel play, they don't play together as such. But if you observe long enough, you can see them turning back to see if the mother is around, or sometimes if they have if someone hurts them or if they fall, they quickly come back and hug the mother, cry a little bit, and but they go back. So you need to culture that bond of trust where the child feels that the parent is there somewhere, not hovering over him, but somewhere there that he can run back to and cry on. Your toddler might hug and cry with you, but your teenage son might not do that unless you have shown him that you can be totally vulnerable with me without being judged. So that level of trust you can't build when he's 15 years old. You have to start building it when he's 3 years old. Because this is something I come across day in and day out with youth with problems. They come to my clinic with parents and asking them, doctor, tell me anything. My son is using drugs and he tried to take his life twice. I would do anything to make this correct. But that your window of trust might have passed. I'm not saying it's a lost cause altogether, But for all parents in general, be that person who can spare the time even if you are in a rush, because finally you are going to work, you are earning, you are doing all these things because you want to earn to ensure a good future your child. So in doing that, if you lose out on the relationship, then that whole project might fall out. So have time, spend time, and build the trust. So when they come to you with a problem, or even if they don't, if you see that they are in a problem, you should be proactive and go and ask, Puta, I see that you are not yourself these days. Would you like to talk to me? Maybe not now. Think about it. I'm there for you. Just that sentence might not take a few seconds to say, but it will mean a lot to your son or daughter.
Beautifully said, Doctor. Now we're heading into one of your pet topics, and that is the concept of minimalism. How does it contribute to improved mental health and mental well-being?
Okay. So minimalism is a concept I came across myself. As a doctor, I had to move from one place to another. I was working in very far off areas, and I had to move from one quarters to another. And then I realized when I'm moving, I have stuff that fill out 2 lorries. And I was thinking, I only use only a 10% of this stuff. Why do I need all these rest of the stuff cluttering my space? That is where it started, and then I started reading. And physical space, we have a limited space in our room or the house. Similarly, the mental space is also limited. So if we clutter our available visible space with stuff, it will not only take up your valuable space in your physical area to live a comfortable life, but it will also take up your mental space, right? Those things are existing, and maintaining those things and navigating through those things. Say a simple example is our cupboard full of clothes, right? Usually what I find is you have a lot of clothes that you don't use and have a couple of pieces that you wear every day. So every day you go through all that pile to find that 2 pieces, spending your valuable time, space, and mental peace. So, and in addition, minimalism is a concept that will help your pocket too. These days with New Year coming, I see a lot of people, crowding the shops and buying things on impulse. Impulse buying is a problem, especially when you have a smartphone on your hand and there's a lot of online shopping. The moment you think about something, you go and you buy it. In earlier days, when there were no online access, people had to actually sit at home, sleep on it, and probably on the next day only they could think of buying it. By that time, that impulse would have gone down. So we are facing that issue of hoarding things which you have bought on impulse. So being aware of and the other thing is this also can turn into a mental illness.
Really?
An addiction. There is an entity called shopping addiction. So as there is more potent to buy on impulse, it can escalate quickly into an illness. So that's something you have to always keep your mind alert on.
Now, Doctor, anger management, a concept that is easier said than done to most of us, right? Walk us through some of the insights, Doctor, because a lot of experts in the field say to not get angry, do this, but sometimes it's beyond, it's sometimes impossible to do. Give us some simple tips that we could follow in our day-to-day life.
Okay, so before coming on to the practical tips, I'll quickly go through the concept of anger.
Sure.
So why is anger there? I mean, why have we developed this concept of anger if it is so harmful? Usually whatever feature that we have as humans have developed over generations because it serves a purpose. Similarly, anger serves a purpose. It is necessary, right? Anger prepares us to face certain situations that might potentially challenge our safety, either physical or mental safety. And it alerts you and physically readies you to protect yourself. But the problem is how you express your anger. I mean, anger is a natural emotion. There's nothing pathological about feeling angry. But as humans, you have a choice when it comes to how you express it, right? The two main ways of expressing anger is either aggression or assertion. Aggression might have been needed when we were living in caves as, cavemen. When you had animals coming to you and, a lot of physical threats, you might have needed aggression to fight it off. But now, in civilized societies, you can turn it to assertion. Assertion is being able to express your needs and wants and thoughts without being rude or physically violent, but effectively, so that it makes the change that you want, right? So how are we going to do that is the question. In anger management, there are 3 areas or 3 points that you can intervene. Usually people try to control anger after it happens, right? But there is a point before that, Identify the situations that you make angry, because it's a pattern, like a specific person has specific triggers for anger. So that, for example, if I get angry, if someone cuts the queue, I might try to find a time when there are no queues. I mean, queues are less, right? So avoiding situations that make you angry will be much easier than trying to tackle your anger after it happens.
So this is where self-awareness comes into play, introspection.
You have to have a kind of a mindfulness, right? We do things mindlessly most of the time. We get angry, we say things and we do things, and only after we see the repercussions, we sit back and think, oh my God, what did I just say? Yeah. But, being aware of yourself is also important in controlling your anger. But there are certain situations that you can't avoid. I mean, certain things you can avoid, but then there are certain things, say a nasty boss at work, right? You can't avoid. I mean, you can walk off, but then you don't have a job. So in those situations, how am I going to tackle it is the question. Sometimes the same situation that makes, you might have seen this as well, the same situation that makes one person angry doesn't do anything to the next person. Why is this difference? Because it's how you look at it. It is your interpretation of the situation. Like, I'll take the same example, a person cutting the queue, because it personally triggers me a lot, right? So a person cutting the queue, jumping in front of you, just stop and think before you automatically get angry. Stop and think, what could be the reason this man doing this? Probably he's ignorant. He's not educated, right? His parents haven't taught him. Or he could be having some mental disorder. He might be confused. Or it could be a real emergency, like someone dying, I don't know.
Yeah.
So once you go through this self-analysis, it's very surprising to see that natural anger has converted to sympathy. Poor man. He hasn't had appropriate parents to tell him this is wrong, right? So that is reframing. The same situation, you induce a different emotion. Okay, so if you fail at that stage also, you are really angry, right? What do you do with that then? Then there are certain strategies, like very brief strategies, where you can take a couple of deep breaths. Just focus on your breathing only, nothing else matters at that point. And then count from 10 to backwards, 10 to 0, slowly while breathing. What are we creating here? We are creating a gap from the emotion of anger to the point of expression. We are creating a gap, because that intense anger is where we do things that we repent later. Anger will subside, so we are waiting it to subside, and when you come out of it, you are able to choose a more appropriate response.
All right, doctor. Now, media, we play a very crucial role in every aspect, not just medical, but every aspect of life we play a crucial role, any media organization. As a responsible media outlet, how do you expect us to do our part in supporting the medical sector in improving the standards and an improved mental health arena in Sri Lanka?
I think what you are just doing now is a very good start. So, creating this platform for mental health professionals to address the public, that is one of the most important things, because you know, in this commercialized economy, the highlight is given to certain parties that bring in the money rather than, you know, the professionals. So what you are doing is very appreciated. And at the same time, I think the social media presence, and I think you have your social media presence, so reaching out to people who can actually use this information, like youth and, you know, sometimes even the elderly is a segment that usually misses out on this access. So media can think of ways, innovative, creative ways to reach out to these people, maybe like in, you know, campaigns in schools, organizing certain competitions in relation to mental health, so they get opportunities to interact with the professionals and people in mental health would be a good way of you know, improving the mental health literacy.
Doctor, how can an individual recognize if they're reaching their burnout?
Burnout compared to stress is a bit different, whereas, as I said, stress, you look very agitated and wired and, you know, unsettled. Burnout is a long process where you burn all your fuel, the energy, and you come to a kind of a powerless stage. The person appears as if he has given up on things, right? So in burnout, people are not typically anxious, but they are gradually falling out on life, in family matters, in career. You might see him, you know, functioning less than before, but not outwardly, you know, carrying on. So I think this is a place where all of us as a community should be aware, because the anxious person, the depressed person might get recognized, but the person who is burning out might get left out because he's not asking, he doesn't look like a person who needs help, but gradually slipping away.
What about, how do you advise employers? How do you advise them to create or foster an environment for their employees who undergo mental health issues?
I think it's physical alterations in physical environment as well as the psychological environment. Physically, I mean, certain offices does not even provide the basic needs like good drinking water and, you know, breakout rooms or places to rest if they feel tired. So those are simple things that can be done. And, you know, certain workshops where their awareness is improved and having a nominated person who they can reach out. I mean, people don't like talking about these things in public, so have
like
someone.
A counselor.
Yes, like a counselor that they can open up without feeling vulnerable and someone trustworthy. So that availability and networking with mental health services even. Like I've been approached with some companies have approached me, you know, asking me to deliver speeches about stress management, anger management. So make it a more like annual or, you know, frequent thing. Right?
What about individuals, doctor, if they want to start asking for help, and if these individuals don't have access to affordable mental health care in regions that don't have much or limited resources, How would you approach this situation?
Well, I'm happy to say that since I started working in mental health profession, services in mental health have grown exponentially. I'm talking about the government sector. So it might not be the mental health specialist as such, but there are clinics in most of the peripheral hospitals dedicated to mental health, run by a medical doctor. So if someone is...
This is outside Colombo, doctor?
Yes.
Right.
All districts. We have different levels of hospitals, like you have the district hospitals, then you have the base hospitals, the district general hospitals and teaching hospitals. It used to be concentrated in the main hospitals before, but now it has expanded into the regional hospitals as well. So if someone is feeling as if he needs mental help, then they can reach out to the closest regional hospital, and they will be directed to, it will be a certain day, but they will be directed to a clinic dedicated to mental health.
So basically there is help available.
There is
even
help
outside
available.
Colombo. For people who think that there are not enough resources, there is help available, not only in Colombo but outside Colombo as well. Doctor, before we close, I invite you to briefly your final message, your take-home message to everyone watching us today.
I think mental health, we need to consider it as, your daily, part of your daily routine, like eating, drinking and going for your job. Things to improve your mental health should be a part of your routine. A person should not wait till a problem happens to think about mental health. It should be doing things routinely, like exercising and talking to people who improve your mental health, and even certain relaxation strategies should be incorporated into your lifestyle rather than waiting till a problem occurs.
All right, doctor, thank you very much for joining us today, and thank you for taking the time out of your busy schedule to have this very informative conversation, and a conversation that needs to be addressed.
Thank you so much for inviting me.
All right, join us again next week for a story that will ignite change. Until we meet again, stay safe and have a pleasant night.